Hello, it's April from Pelvic Balance. I want to talk to you today about the old way of postpartum healing versus the new way of postpartum healing. Things have changed, or at least they should change. We're getting there. But let me tell you about how that used to look. So you had your baby, and at 6 weeks, you would have a visit with your physician. That was your postpartum visit. And if everything looked okay as far as there were no signs of infection, tissues seemed to be healing okay, you didn't report any significant issues, then usually you were given the okay to go back to whatever you'd like to do. Whether that's just your regular daily activities, or if you were into exercise, getting back into exercise. And that was about it. Not a whole lot of direction. You know, you might have asked, well, what can I do as far as exercise? And they might have said something like, well, just work back into things gradually, you know, or avoid anything strenuous at first. And that was about it, which the physicians are not the exercise professionals, so, you know, they can't give you a whole lot of advice there. But that was all the direction you had. So let me tell you the new way of postpartum healing. The new way involves healing that's more comprehensive. So what I mean by that is healing on not only a physical level, but we're also looking at the woman's healing from an emotional and mental perspective as well. So not only is she healing well physically, but what's going on with her mentally and psychologically as well. How is she feeling with all these changes that have taken place? It's a very important part of healing that we can't skip over. So it's about time we include that. And then looking at healing from a continuum point of view. So it's not just 6-week follow-up visit and then that's it, good luck. We need to be checking in with this woman every so often, providing guidance to her along the way to make sure that things don't just pop up later down the road, because that often happens. What you are feeling at 6 weeks postpartum can be very, very different than what you might feel like months postpartum. And it could be that you're doing much better, or it could be that you have now developed some issues with pain. You know, maybe you've found that you're having pain with sex, or maybe you had some bladder leakage that has now worsened or didn't go away, because if you've had that right after having a baby, that should be going away within 3 months. So we are providing this care and this guidance so that women are not only getting the treatment they need right away, but they're also preventing issues from developing later down the road. And it's so very important to not only your postpartum healing, but for the rest of your life, your reproductive health, because there are so many times where these issues that I was mentioning develop later on down the road, and we can say that pregnancy and birth was possibly a factor, because we're seeing that in studies that is a definite risk factor for some of these things to develop. So why not try to prevent it? Why don't we give women the best shot at healing possible and give them the care that they deserve? They deserve more than one little visit postpartum. So that's why I created a program called the Postpartum Revival Program, because I want women to come away from having a baby with not only just a feeling of healing, but a revitalization. I want them to feel even better than they have before. And I feel the way to do that is to encompass all these different aspects of healing and provide them with the guidance that they need, so that they're not only reaching the goals they want physically, you know, getting back into exercise, maybe, you know, being more fit and healthy, but being well mentally and emotionally too, because when we're not, that can show up in our body in physical ways. So we need to make sure that we're addressing that as well. So the program I've developed addresses all of those components, and we can fine-tune things to make sure that you're getting everything you need out of that program. So I have more information about it on my website, Facebook. Feel free to reach out to me with any questions or concerns. And I hope that you will join me in the program. I look forward to working with you. Thank you and have a great day.